started. Right. All right. Thank you for joining us this evening to learn more about the health effects of soot or particulate air pollution and the proposed soot rule, which is intended to help address, reduce soot pollution. My name is Sandy Bahr. I'm the chapter director for Sierra Club in Arizona. I use she, her pronouns, and I live in Central Phoenix on the traditional lands of the Acamel Atam and Pipash. And I am facilitating tonight's panel discussion. We have with us Will Humble of the Arizona Public Health Association and Madeline Page with the Climate Action Campaign. You're going to learn what you need to know to comment, to urge the Environmental Protection Agency to tighten up the proposed rules on soot, and of course, a lot more about the public health impacts as well. I'm going to introduce each of the speakers, and then Will Humble will go first, and Maddie Page will go second. So Will Humble is a longtime public health enthusiast and is currently the executive director for the Arizona Public Health Association. His 40 years in public health include more than 2 decades at the Arizona Department of Health Services, where he served in various roles, including as the director from 2009 to 2015. He continues to be very involved in health policy in his role as the executive director for the Arizona Public Health Association. Will is a believer in using evidence-based health policy to improve health outcomes and in leading and managing with emotional intelligence. And Maddie Page is the Climate Action Campaign Deputy Director of Government Affairs. She's an experienced organizer, funder, strategist, and campaign manager who's led and worked in coalitions at the state, regional, and national levels. Most recently, she managed the Western Conservation Foundation's National Public Lands portfolio and ran its grant-making, communications, and advocacy work with partners across the West to advance public lands protections and defend against oil and gas development. And prior to that, she led public citizens campaigns to protect the clean car standards and hold the auto industry and the Trump administration accountable for their rollback efforts. Maddie got her start working on electoral campaigns as an organizer with Environment America. And with that, I am going to turn it over to Will to talk more about the health impact of particulates, and he'll talk a little bit about the rule too. Will?
Okay, thanks, Andy. And Maddie and I, maybe later on, we could just kind of go back and forth when it comes to talking about like where it doesn't make most sense to focus comments in the last remaining months before EPA finalizes their rule change. So you can't really do this topic justice without going back a few decades, which I'll go fast. I'm not going to go like year by year or anything, but really the first studies, well, the first indication of the relationship between mortality and particulate matter goes way back to London in the 1800s and in the 1900s with industrialization. They used to have these black fogs that would come over the city of London, and the hospitals would be then the morgues would be completely full of people for days and days. They were using coal, of course, to heat their homes and stuff in those days. And that was like epidemiologically, that was such a profound event because you didn't need sensitive instruments to find the relationship between particulate matter and mortality. You could see it in the graveyards. And that was really the first well-established relationship. But as time went by and after EPA formed back in the 60s, and the Clean Air Act was established many decades ago, the research started to get better and better. And there was a 6-city study that goes back into the 80s. Dockery and Pope, this was their initial study that looked at 6 cities in the US and compared all-cause mortality, but also cardiovascular and respiratory mortality and cancer mortality. And what they discovered is by comparing 6 different cities with 6 different annual ambient levels of PM10, they could find a really robust and well-established dose-response relationship between all-cause mortality and in those days, it was PM10 research, which means particles 10 microns in size and smaller. But also robust relationship with cardiovascular and respiratory deaths. After controlling for all the other, as you can't ever say controlling for all other factors, but controlling for all other factors that you can control for, they found this dose response relationship in the 6-city studies. And that started to spark a lot more research on the epidemiology of particulate matter throughout the 90s and into the 2000s. And what the research has continued to describe is that there is this well-established dose-response relationship between particulate matter and excess deaths, premature deaths from all causes, but in particular cardiovascular and respiratory, although not cancer. Some people thought, well, intuitively you would expect cancer deaths to increase as well with increases in levels, but what you see is all-cause mortality, respiratory and cardiovascular. But as they continued to do the research and as the environmental sampling got more robust and EPA started requiring measurements of PM2.5 and PM1, so those are particles that are 2.5 microns in size and smaller, or even PM1, they began to discover that, in fact, when you measure a PM10 standard, that the particle's 10 microns in size, you see this robust epidemiological relationship. But when you start looking at the data more carefully, what you discover is that it's really those very fine particles, those particles less than 2.5 microns, and even worse than that, the particles 1 micron in size, that are really responsible for the majority of what you observe in increased mortality. And so basically what that means is the smaller the particles, the worse the health effect. So particles 10 microns, like if you think about it, particles bigger than 10 microns get stuck in your nose hairs and in your throat, and you might cough it up and like, this is kind of gross, but like you might swallow those particles, but you don't inhale those particles if they're bigger than 10 microns. Less than 10 microns means that when you inhale it, it's going to end up in your respiratory tract. Those particles that are like 5 to 10 microns end up in your bronchi and your pharynx, the upper part of your respiratory system. But as you get finer and finer particles, they go deeper and deeper into your lungs. And so particles that are 1 micron, PM1, that's like diesel exhaust. Diesel's the worst of all the particulate matter, by the way, because it's the smallest particles. It's also combustion product. But those 1 microns can all the way get into your alveoli. That's the lungs, the sac that exchanges oxygen, that does like the oxygen exchange work in your lungs. That PM1 can get all the way to your alveoli. PM2.5 gets really close to your alveoli, can't get in, but can do a lot of damage at the very end of the the brachial tree. So I wanted to just go into that background about why the PM2.5 is such an important standard, because that's when Maddie, when you talk about the regulation, that's what EPA is proposing to change, which I think is a good thing. I think it's better that they focus on PM2.5 and tighten up that standard than it is to tighten up the PM10 standard, because PM10 is while it has an issue, you want the regulations to focus on those very fine particles that are less than 2 microns and force states to do more about diesel exhaust and those kinds of combustion sources that create those superfine particles that do, like, they're the ones doing the damage, that really small particles. So I think it's good that, Maddie, when you talk about the what they're proposing, I think it's a good thing that they're focusing on the 2.5 standard on annual average. And so as the research has progressed, I have to say it kind of has slowed down a little bit research wise, because the relationship is so well established, and like to get stuff into journals these days, you have to have novel results. And if you do another PM 2.5 study, it's harder to get it into journal these days because everyone's like, yeah, we know, kind of thing. So of all the stuff in environmental health, this relationship between very fine particulate matter and mortality and asthma episodes, which I didn't even talk about yet, which is not, that's not when kids die, but when kids keep getting asthma episodes because they live next to an interstate in a state that doesn't do anything about diesel exhaust and stuff. That's a super bad quality of life thing. And anyone who's had kids with asthma, you know how stressful that is just day in and day out, because it's hard to predict what's going to happen. So let me just forecast a little bit, what sort of opine a bit before I turn it over about what I think the EPA is doing here. So what they're planning to do is the regulatory changes are really focused on the PM 2.5. So that's good that they're focusing on tightening the standard for the very fine particles, because those are the ones that do most of the public health damage. They're proposing to move that annual average standard from 12 micrograms per cubic meter down to a range between 9 and 10. So that's good because they're tightening the standard in the metric that's most important. And I also think it's good that they're proposing a change in the annual average standard rather than the 24-hour standard. And why I think that's important is because from a regulatory point of view, it's easier to enforce and call something non-attainment when you're violating an annual average standard, because these states, and Arizona has been during many administrations, just their DQ would just make one excuse after the next for non-attainment of a 24-hour standard by saying, well, this is an exceptional event because blah, 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 New Year's Day, people set off fireworks. Exceptional event because it got windy and these farmers were just getting ready to plant the cotton, blah, blah, blah. So it's a lot harder for states to make excuses on an annual when they're violating consistently an annual average standard. So I think it's good that if they're going to tighten something, it would be tighten the PM 2.5 annual average standard. And that's the one that they're focusing on. They are considering making a change on I'll let Maddie, you talk about that. The other thing that I saw in the rulemaking that's I think there's still some months to go before they finalize it, is that, and I don't know the details of this, I just saw it on the fact sheet, that inside of the rule change, they're proposing some changes to increase the data quality that DEQs, some call them DNRs in other states, DEQs need to use, the kind of data that DEQ would need to use to establish whether they're in compliance or not. And that's important because there are clever people in some of these states and outgoing director and staff at DEQ that were adept at figuring out ways to use poor data quality to establish a false sense of attainment with the PM10 standards. And I think it's important that EPA recognize and improve the data quality requirements so that it makes it harder for states like Arizona. Not that I mean in the next 4 years we're going to be cheaters, but we've got a long track record of cheating. And one more thing, and then I'll stop talking. They also propose that and I don't know the details of this, it just says it in the fact sheet that they're proposing some changes that would require states to look at environmental justice components with respect to the compliance standard for not just 2.5, but also the annual average PM10 standard and the 24-hour standards for those. So in a nutshell, I think I like the fact that EPA changed, like I said, if I was gonna pick one thing to change, it would be the annual average PM 2.5 standard. And that is what they're proposing. It says in the fact sheet that their scientists are considering going as low as 8 micrograms per cubic meter, which would be because right now that's 12. They're planning 9 to 10, and they're considering going to 8, but they're also considering going to 12. That would be, 11. So just going down 1. So my opinion is that for group comments about the rule change, that it should be to compliment them on the fact that they're focusing on the most important of all the metrics and encourage them to go down to 8 micrograms, because there is no threshold. And this is well established by the literature. There's no threshold with this, meaning no matter what the PM level is of 2.5, you can measure increases in mortality and asthma episodes. Now, as you get lower, it becomes less and less epidemiologically measurable. You know, the impact is less, but there is no threshold, kind of like lead in drinking water. There's just no threshold where you can say, okay, this is safe. Okay, so I'll stop talking and I'll stay on. I could stay on for a while with questions if there are any.
Okay, thanks so much, Will. I'm excited to hear and participate in the Q&A with you. Sandy, do you want me just to share my screen now, or did you? Okay.
Yeah, go ahead.
Okay. Let's see if this works. All right, can you all just see my slide deck?
Yes.
Okay, how is that?
Perfect.
Okay.
Whoops. There you go.
Okay. 1 second. Does it if I
I was in presenter view a moment ago.
Okay. Nick, I'm gonna Slack these to you, and can you present on your screen? Because I had some notes that I wanted to be able to reference.
Yeah.
Okay, great. And for some reason, if I'm sharing, it's not letting me do anything but full screen. Okay, so I'm gonna let you pull those up. I just gave you access, but while you're doing that, I can get started. Did you get those in Slack?
Mm-hmm.
Okay, great. All right, well, while I'm getting started, just wanted to thank you all for coming today. Sandy gave me a great introduction, but I also wanted to mention that I am born and raised Tucsonan and got my start actually working on Congresswoman Gifford's campaign over a decade ago. So I feel especially excited to be here with other Arizonans. So thanks for having me. So I wanted to just take a quick step back too to give the overall regulatory landscape and then jump in to the particulate matter standards. So I'll do that really quickly here. I'll just say, oh, you can keep it on that other slide, Nick. So I'll tell you when to move. So just for, I think, to take a step back here, how we got to where we are today. Obviously, for the last 2 years, the campaign has been focused really heavily on, while we had a political trifecta in the House and Senate and White House on winning victories for climate and public health there, But that whole time, while organizations like so many of you on this call were fighting for climate investments in legislation, at the Climate Action Campaign, we were also working with our partners to start gearing up for what an administrative campaign would look like. Because no matter how far Congress would be able to get us with their work, there would still be important public health as well as climate reductions that could be tackled administratively. And that's where Solutions for Pollution was born. And so now with this legislative victory under our belts and congressional action tougher after the 2022 election, we're turning to the next big place where we can win real change, and that's the Biden administration. If you want to go to the next slide, Nick. So obviously we know rules can be super wonky and in the weeds, and we wanted to bring together the top pollution reducing opportunities into one campaign that we could organize around, build momentum around, and infrastructure and just excitement to push the administration to be swift and bold. And so we did a bunch of modeling to figure out which administrative actions could get us the biggest bang for our buck. And that's kind of the ones you're seeing on this screen here. And we're calling it the Solutions for Pollution Action Plan. And it's about 20 rules and standards that the Biden administration can carry out under its existing environmental authority. And we bundled them together on purpose, like I said, so that we could drive a narrative, get people excited, and better to engage the public as well that way, so that we can show overwhelming support for administrative action. And one of the rules on the Solution for Pollution campaign is the Soot rule, and we've decided to really make this one of our banner campaigns, campaigns in the Solutions for Pollution Action Plan. Like Will said, particulate matter, PM 2.5, the kind of layman term is soot. You can go to the next slide, Nick. But as Will mentioned, it's an incredibly fine particulate matter, or soot, is an extremely dangerous pollutant. It's a deadly mix of metals, organic chemicals, acidic substances that are so small they can be inhaled deeply into the lungs and into the bloodstream. And I just think this graphic from EPA helps you understand just how tiny these molecules are. So, smaller than a shaft of hair by many, many times. It is these pollutants that come from a number of sources, including power plants, vehicles, wildfires, wood stoves, as well as industrial processes that form soot pollution. Soot pollution is linked to asthma attacks, heart attacks, diabetes, infant mortality, dementia, cancer, and even more. And it causes at least 48,000 premature deaths annually in the United States. And I'll just say that communities of color, not surprisingly, are disproportionately impacted. And at the same time, over 63 million Americans experience unhealthy spikes in daily particle pollution, and 20 million Americans experience dangerous levels year-round, according to the American Lung Association. Luckily, this is the good news part of the presentation. The Clean Air Act requires that the Environmental Protection Agency set national ambient air quality standards, and you'll sometimes hear people refer to that as NAAQS, which is the acronym NAAQS. And they have to set those for several different pollutants, including soot, and another big one in that list that they have to set is ozone standards. And so every 5 years, EPA must review the NAAQS pollutants, consider new medical and scientific evidence, and decide on whether the standards should be updated. The EPA under the Trump administration ignored the science and left the old standards in place and decided not to update the standards according to the new science. And so this update that we're working towards right now is a long time coming, to say the least. And that really does bring us to today. So earlier this month, after months of delay, the EPA issued its proposal for updated Soot standards, and it's a step in the right direction, but as Will dug in on a little bit, it is insufficient. So EPA proposed, oh, and you can go to the next slide. Sorry, I forgot about my slides. I'll just say one thing here, just a little bit, just a little graphic that I think is helpful from ALA about how air pollution harms children and adults. You can go to the next slide, Nick. So unfortunately, EPA proposed several options, none of which met what the environmental, public health communities were asking for. So the community had been united in calling for EPA to finalize a standard of no higher than 8 micrograms for the annual standard and 25 for the 24-hour standard. And unfortunately, they proposed a range of 9 to 10, like Will mentioned, and they proposed keeping the 24-hour standard at the current level. And the 24-hour standard is really critical. It's critical for protecting against short-term spikes in air pollution and provides the basis for the air quality index that people know about and like to look up on their phones. And I'd say that, really this is a particular concern for environmental justice because this impacts so many of the communities that live nearby to polluting facilities. It was a disappointing proposal that we saw, although it was a step in the right direction because, there will be lives saved if they do ratchet down pollution. However, all the science is there pointing to them needing to go even further. And I will say that 8, which is what we've been calling for, is not even as low as a number of institutions have said it is proper. So that, for example, the World Health Organization has recommended no higher than 5 micrograms for the annual standard. And so when we see the EPA putting out a suggestion of 10, almost double that, it's of concern. But really, right now is the time to change this. So the public comment period is set to open soon. The rule has been announced by EPA. We're just waiting for it to be published in the Federal Register, which could happen any day now, but probably in the next couple of weeks. And once it's published in the Federal Register, that'll kick off a 60-day public comment period where it's really critical for the EPA to be hearing from members of the public, experts, medical professionals, impacted communities, and so that we can push EPA to reconsider, go with a stronger standard, what the community has asked for. And I'll also say that as part of that comment period, there are big plans to collect 500,000 public comments, get grass tops folks across the country to weigh in, and there will also be virtual hearings so that people across the country can speak up, give testimony, and make the case for a stronger standard. So we've still got a chance to ratchet this down to the levels that the community has been calling for, and that's why I'm very excited, because I think that with your help, we can really make the case to EPA. I'll stop there.
Great. Thank you so much, Maddie. Thank you, Will. We'll go ahead and open it up for questions. Again, you can either raise your hand or put your questions in the chat. I am not seeing any yet.
Would we be able to get copies of the slides that you've shared? Because there's a lot of good data on there.
Yes, I am happy to share those. And then we also, which we can share, have sample talking points, some research documents as well, and I think we even have a Arizona state fact sheet as well that will probably be useful for you all.
Perfect, thank you.
Mm-hmm.
And we can also share this recording if you want to go back and check things out too.
Yeah, so I'm not entirely sure the connection points in Arizona, but I will certainly be working with Nick, who works closely with Sandy when that 60-day comment period opens. I'm sure you all will know very quickly,
Yeah.
but we'll be alerting folks to that. And I've got a little automatic alert set up for when that gets published. So hopefully I know the morning up.
Yeah, we'll be sending out various groups, I should say, so the groups in Arizona involved with the climate action campaign include Sierra Club, Moms Clean Air Force, Podar Latinx, Arizona Interfaith Power and Light, and we've also been working a lot with Defend Our Future too. And it looks like there's a hand up from David Myers. Go ahead and unmute yourself, David, and ask your question.
Okay, hi, thanks for this wonderful information. Where does clean diesel come in the PM, so-called clean diesel, come in the PM scale? Is it better? And are heavy trucks and buses using that clean diesel fuel anyway? Thank you.
Okay, so you got me on that. Like that's your question is are biofuels less harmful in terms of the emissions than straight diesel? I don't know the answer to that question, to be quite honest with you.
Well, I'm thinking back in the day and today, even you'll see some vehicles on the road that when they accelerate, you get a black cloud. But not all light trucks and diesel vehicles produce that white cloud. So I'm wondering if that means their PM sizes are smaller and still insidious, or because I assume that the black cloud is bigger particles.
Diesel combustion is still really harmful, and cleaner diesel is, we tend to call it slightly less dirty. So that's, it's still combustion, and you still get those fine particulates. We have to stop burning things. That's a big part of the problem, including to move our cars around. So
yeah, the way I look at the importance of this PM standard, for the PM 2.5 standard, if we can move it to 8, is that it would pressure states like Arizona to actually start requiring more compliance checks and tightening standards for diesel trucks, and that's why I think it's important to focus on the 2.5 standard rather than the PM 10, because that allows them to look. Their compliance measuring stick is PM 10, which then they're going to go after other than diesel, when we know that diesel's exhaust size is the most harmful component. Not to say that, there's not other bad sources of PM, but in my opinion, the truck and industrial lobbies have been really good at ensuring that our DEQ at least, in our non-attainment areas has not pressed for better diesel standards that, like all of our other regular cars have to go through on emissions.
And the current proposal is just for 2.5, so that's what we're talking about.
Yeah, they're not proposing to change the 10, and I think that's okay, because if they were changing the 10, then they would be focusing on the part that really you don't get the most robust results. If you're going to tighten one thing, tighten the fine particulate standard, because that's where you're going to get the biggest bang for your buck. With as you tighten the screws, you're going to get more improvement in not so much visibility, but in terms of the public health side of things.
And it looks like Melanie Bikeman has a question. Melanie?
Just to that comment, if you tighten the 2.5, would you naturally be tightening the 10 too by reducing emissions on 2.5? You just generally reduce emissions. Is that?
Well, it depends on the interventions that you use.
Okay.
But you could, I could envision, tightening and, improving PM 2.5 emissions and having it not even be a measurable difference on PM 10, but you'd still enjoy the public health benefits because you improved air quality in the most important component. Because the PM, the 5 and up is, a lot of that is like re-entrained road dust, things like chip sealing roads and things like that helps to improve or reduce that larger particulate matter. Re-entrained paved road dust is actually a big component of particulate air pollution. And so that's an important thing. And it's important to keep, the compliance tools for that are pretty unsophisticated. It's like requiring construction sites to not allow the trucks to drag the dirt into the road, and requiring the watering trucks to go by at the construction sites and things like that. So that, depending on what you're trying to accomplish, you have a different intervention. In my view, by tightening 2.5, you're pressuring states to start paying more attention to those combustion products like diesel, which is what causes the biggest public health harm. So that's why I think that's good. Although I'd like to see them go to 8 or something lower than 8. But hey, if we can get them from 12 to 9, that's on a 2.5. I think that's substantial. Is it sufficient? No, but long ago I became a pragmatist rather than an idealist.
I'm looking for other questions. I guess one thing I was going to ask is I've actually seen particulates, the fine particulates described as really the biggest, environmental public health issue because of the broad range of harm that they do. I mean, every time I see research, there's more harm. And I was just wondering what your opinion was on that, and you can both answer if you'd like.
Well, I feel like you're the public health expert, so I'll let you take that one.
Well, there's such a broad range of harmful environmental things. I mean, I could say this, there's, in a lot of research for a lot of environmental health and in epidemiology, there's often some ambiguity about, is it statistically significant? What's, the dose response, if there is one, and that kind of stuff. There's none of that with PM 2.5 and lower. There's just none. There's no ambiguity. Like, it's super well established to be harmful in so many different ways, not just all-cause mortality, but specifically respiratory and cardiovascular issues, and not just death, but also changes in pulmonary function. I mean, you can measure changes in FEV from kid to kid, depending on the neighborhood. If you sample enough kids, you can see the difference in the forced, this is the forced volume, like lung capacity of kids and adults depending on, what the PM1 and 2.5 levels are there in their community. So it reduces lung capacity, your ability to exchange air. It's not just, mortality, it's also quality of life.
Melanie was asking, what are the industries that are lobbying the EPA against this rule?
Yeah, so handily, it is public record, some of the industries that have gone in to meet with the Office of Management and Budget on this rule, and it's a kind of classic cast of characters. I just pulled it up seeing that question. So we've got, BP, Phillips 66, American Petroleum Institute, Chevron, the National Manufacturers Association or Association of Manufacturers. So polluters are the big ones. And I'll say that these aren't opponents of the standards, but you do sometimes come across elected officials who are nervous because the way that this works is that once the standard is set, basically there's a 3-year average of data that's evaluated to determine whether states are in attainment or in non-attainment of the standards. And if you're in non-attainment, that's just sort of like a spooky thing for states, and they are worried about being in non-attainment. But if you are in non-attainment, then your state has to draft implementation plans detailing how you're going to meet the standard and what the time frame is. But you'll have, you can quite literally on a map see, well, at this rate, these counties across the country would be in attainment and these wouldn't. And you can see that kind of map light up as the standards get ratcheted down county by county. And elected officials can be worried about showing up as being in non-attainment. And I think an important message point for that is just that, yes, but communities have a right to know about their health and the quality of their air. And so just because localities will be in non-attainment is not a good reason to not strengthen the standards.
Okay, great. I think this next one is for you, Will. You shared that the WHO recommends 5 micrograms and lower. Do we know any other countries' standards for comparison? Is curious, and that's from DJ Portugal.
Yeah, I don't know, for example, what EU has. Do you know, Maddie, what the EU standards are?
I don't. It is a good question.
Yeah, I just don't know the answer to that. I didn't look at, I could have, Googled it and found out, but I didn't.
Okay.
I didn't do that. I would say, just tying back to what I think Sandy you just said, or Maddie, maybe what you were just saying, if they were to go from 12 to 8, let's say, ideally, right now they're proposing going from 12 to between 9 and 10 on the primary annual PM 2.5. Let's say they go to 8. I don't see any other places in the state that would go non-attainment. What I would see is that area A and B, Phoenix, Tucson, it would be more challenging for them to get into attainment. They'd have to do more things with PM 2.5 in order to be striving towards attainment. But I wouldn't see places like Flag or even Yuma probably moving to non-attainment. I don't see any more non-attainment areas. I would see that it would the Phoenix and Tucson areas would need to, not just Phoenix, because it goes into Pinal County too, would have to do more specifically on soot to strive towards attainment.
Okay.
And by the way, one of the things that you didn't mention is if a state is obstinate and says we're not doing it, well, then you lose your delegation agreement and EPA will do it for you. You still have to pass state laws and things like that, but there's ways the federal government can punish you for not striving towards non-attainment. Of course, that depends on who's in the White House and who the EPA director is in terms of how hard they press states.
All right, great. And Bill Elliott asks, what will it take to make these environmental public health concerns part of the public debate at all levels of political campaigns?
I thought Nick's answer was good in the chat.
Oh, did he answer it? Sorry, I'm just looking at the questions.
Bill may want a longer answer than that, but I thought the answer
Yeah.
organizing is a good answer to that.
Okay.
Oh, what was the answer?
Well, yeah, and I'll say that like a lot of the country's leading health organizations, including the American Lung Association, the National Medical Association, like there are a bunch of groups that are very tuned into this because of all the reasons that Will talked about, how big a problem this is for public health, PSR, others, and so Physicians for Social Responsibility. So the good news is it's definitely part of the debate, and EPA's own scientists suggested, their own scientific advisory board suggested the lower standards, and so we just have to keep sharing this story, having people weigh in, pushing them, like Nick said, organizing. But the story and the advocates and the data is out there. So.
And Peggy asked about, will there be materials for activists to use? The answer is yes, lots. And I see Hazel answered that. Let me see, what other questions do we have in?
Wendy, can I just insert? I've had a couple conversations with City of Phoenix, and I understand that there's a lot of concern. City of Phoenix has got some additional attainment issues going on. And so I think it's really, really important those up in the Phoenix area do everything we can to get the word out on the health impacts and why it's so important in media, in letters to the editor, in op-eds, in talking to groups. These are all really, really important because there may be some pushback here. There has been across our state over the years, and we really need to help educate the public about how important this is. There's some of us that, every single time we have higher levels of, or even slightly higher levels of PM 2.5 that we have very difficulty in breathing and functioning, and so we need to help put that connection together. Our communities, like our communities with older people, would be a really good place to outreach as well. So I know we've got a couple of people, I think, on from the Sun City area. We do some public things in the Sun City area to help educate.
Great, thanks, Hazel. Will, were you going to jump in on something?
Well, I was just going to jump in, and maybe this is a question for you, Sandy, is like, we're in a, we forget what it's like to have a friend in the governor's office because it's been so long, but I'm wondering if we could get Karen Peters, maybe after her Senate confirmation, get Karen Peters to write a letter on behalf of DEQ urging the 8 standard, or maybe since she needs Senate confirmation, maybe coming from, I don't know, is there an environmental policy advisor yet?
Not yet, but excuse me, that I think that would be a really good thing to ask the governor's office to do.
Yeah, rather than like at first I was thinking about Karen, but then I'm like, well, we don't want to jeopardize Senate confirmation, so it'd probably be better coming from the governor's office. And
Karen, will be the new ADEQ director. She starts, I think, on February 21st. Nancy?
Yeah, thank you. Hi, everyone. Nancy Herrera here with Poder Latinx. We're a nonprofit organization that works closely with our Latinx community here in Maricopa County. Just going off of what Hazel said, being more involved with our elderly, knowing how it affects their health. Also understanding the racial disparities. Phoenix is notorious for poor air quality. African Americans are considerably more likely to live in areas with the worst level of particulates and ozone. The main ingredient of smoke, according to nationwide study by Miranda and colleagues, Hispanics and low-income residents also are overrepresented in counties with high fine particle pollution, and cancer risk for air toxins such as benzene and help me out with this word, formaldehyde, thank you, are greatest in the nation's highly segregated metropolitan areas. So, our goal at Bahr Latinx is to provide an environment where people can enjoy the same degree and protection for environmental hazards and bring awareness into our community of what's happening, how can we get involved. And I appreciate this space, learning more and understanding, more perspectives from everyone on this call. Thank you.
Thanks, Nancy. Let's see, it looks like there might be one more in the chat and then we probably should wrap up. I don't know what it says. Oh, the Soot fact sheet. Maddie put the Soot fact sheet in the chat, and yeah, look for more information coming your way and from the various groups. And we'll be doing a lot of different activities to get people engaged. We'll have postcards. We'll have information at Environmental Day at the Capitol on February 7th. You can make a comment there, and hopefully you'll sign up to testify when they hold the virtual public hearings. I know a few of you did that for the methane rule. I thought that was really effective, and so just wanted to encourage folks to do that with this as well. And I think with that, I don't know if Will or Maddie, you had any final comment, but I just wanted to thank you both for taking the time to be with us and sharing all of the information that you did.
Yeah, thank you so much for having me. I just wanted to say one thing in relation to the last point, that we are developing more materials on specifically the justice issues related to PM pollution, and it really is staggering, just like the difference, for example, between the 9 standard, which is the floor of what EPA suggested, and a proposal and a standard of 8. So for Black communities, the deaths are cut in half if you go from 9 to 8. So there are really a bunch of sobering facts and implications here, and we're gonna hopefully be able to have those pitched in a way that can help you all in your advocacy. So more to come, like you said, Sandy, but thanks for having me.
Nothing for me. Thanks for the invitation today. Always a pleasure, and everybody have a nice night.
All right, thank you both. Thanks everyone.
Thank you.
We'll be in touch. All right. Bye
Thank
now.
you. Bye-bye.